as part of the previous study we were talking about, one of the things that came out from it all and has come out on various discussions is in cattle that actually AR, resistance, as Eric pointed out, in the cattle world is not viewed as an issue, but actually, if we started to see resistance in lungworm, actually that would be a bigger concern to the industry. And actually, we have over the last little while sort of anecdotal evidence that the sort of epidemiology, that the actual disease in lungworm is changing. So that was really the driving force. We know that lungworm, as pictured up in the top corner, likes wet, damp, warm climates. It's particularly an issue in first year grazing cattle, but it's also becoming a bigger importance in adult cattle. And as I say, there was that sort of concern that we're starting to see a change in the disease pattern. And actually, the graph at the bottom left-hand corner really highlights that quite nicely. This was Scottish data, but I wasn't able to get the sort of wider data, which is the whole UK, but it highlights quite nicely there that over the years we've started to see more and more of an issue of diagnosable submissions in Q3. What would be really interesting to see is whether or not those submissions in Q2 are also showing a very similar pattern, and we're seeing that. And as I say, anecdotally, there is sort of concerns that that's the case. And also over the last few years, we've had a lot more conversations with vets and the industry about failure of anthelmintics against these ones. But again, we don't have a very good set of tools to look at resistance. Unlike with the fecal egg count reduction test, the tools that we have for lungworm aren't as well established. So it was trying to pull together the sort of pharmaceutical industry to try and say, well, okay, how do we go and address this? So we held a workshop. It was held at the beginning of this year. It was designed as face-to-face because I think everyone was fed up of only solely digital meetings. So it was held up at Morden. We had 16 folk there, which was a nice enough set of people from across many of the different pharmaceutical industries. From vets were there, individuals there too. And yeah, it was really as a sort of two-part of it. So we had roundtable discussions and we had smaller groups where we were actually able to use this online whiteboard tool. I'll show you some of the outputs from it, called Miro. And again, it allowed us to sort of, it was really like the old sticky notes. It was a replacement for that in a more environmentally friendly fashion. So the sort of remit from it was that we wanted to get opinions on the current perceptions around lungworm and anthelmintic sensitivity or inefficacy in cattle. We wanted to come together with some guidance on how we might assess anthelmintic efficacy in the field. What steps should individuals take if drug resistance is suspected? What were the sort of research gaps that existed, and how might we address them? And what were the sort of opportunities that we had for getting better messaging across? So the outcomes from the workshop. This is the outcomes from the Miro boards. It was really just a highlight there. It's not really for you to read necessarily, but it allowed us or individuals to come along and put their thoughts on it so that we could gather as wide a range of opinions as possible. So again, it's a nice way, a new age approach to a very old approach to gathering information. So again, we've got how do we assess in this case, we were looking at ML inefficacy, but actually it expanded out to just anthelmintic resistance in the whole, and what are the practical steps that we do with and without sort of vaccine usage for lungworm, because obviously we have a vaccine for lungworm, whereas we don't have a commercially available. We don't have as many options for the other GINs. So really, when from the sort of state of play of lungworm and AR, I think there was a general consensus that lungworm represents a significant threat to the industry. That actually the reported cases, and this, when I got the data from SAC, they were very much the point of saying, well, actually be aware that this is there will be underreporting. It's only individuals who are reporting cases, and those data are things to bear in mind. But I think they still showed an upward trend. So yeah, I think we are only starting to see the tip of the iceberg. There is an underreporting and a lack of understanding of the strategies there, but that's an opportunity for us to sort of develop knowledge exchange outputs that we can help with this. That the time for sort of developing these unified approaches is now, whilst we're still at that sort of beginning part of it, and that we need to look at sort of resistance in the whole. Again, the macrocyclic lactones often get bashed in cattle for resistance development to it, but again, it's not just that, as was shown in the talks before, that actually resistance is an issue across the board to all of the classes of anthelmintics, and we will see that with lungworm too, I'm sure. So again, what were the sort of thoughts as how do we assess efficacy in the field? There was a discussion, and the sheet on the far side highlights what we came up with a sort of flow of how we were going to do it. It's to go out to cows for agreements from there, but again, we will we'll put this out for general consumption once we've got sort of ratification. But there was talk about how do we diagnose it? Do we use post-mortem where it's possible? Do we look at egg counts or larval counts? Again, a discussion about what that sample size would look like. Do we want to look at blood tests for ELISAs, or to assist with alternate diagnoses, or can we sort of use nasopharyngeal swabs and these sort of things? Again, there was a discussion about what sample size was. We decided that sticking at 10 to 15, as was used with the drench check, is a sensible approach. There's no point in changing things for the sake of it, but also then what do we do? So once they've been sampled, what do you do with them? Once they've been treated, again, there was information on that. So management post-treatment, but also, as Leslie alluded to, a lot of just because we see failure doesn't mean that it's resistance. So again, it was really important to have a look at that sort of metadata of what was there, what drugs were used, how had they been stored, how were they administered, how were dose rates set, again, and also to set that expectation that not all apparent failures are down to resistance, and that came across really strongly. And then there was the point of going, well, actually, okay, we should be reporting suspected failures, even if we aren't able to confirm this in the case. The more we can build up an industry understanding of potential failures, the better it may be. So again, it was that sort of request that even if there's only a suspicion that it's not working, it's worth reporting it to the VMD through their SLE system to ensure that we do get a better understanding of this. Again, what are the sort of practical steps if we have it? Is there options for the use of vaccines within it? Going back to the first talk, one of the best ways of doing this is not bringing the problems onto farms in the first place. So better use of quarantine treatments, benchmarking and risk mapping. If we have issues, and we know, one of the things for GIN, for gastrointestinal roundworms and lungworm, is a loss in productivity. So again, understanding what is happening in animals and risk mapping where they go. Again, from previous talks, that's mapping of where issues might be is really important. Can we use diagnostics better? And are the ways that we can reduce the reliance on those anthelmintics. And Leslie mentioned this, it's not all about chemical intervention, but it's how do we better use the sort of other alternative strategies that are there. And again, there's sort of information there on how that might look in the future. Yeah, so I think from it, the outputs, I think it was good that we were able to get almost all of this in the pharmaceutical industry and a good number of vets and advisors there. We have developed these pro formas. As I say, they're currently cows are to meet next week, so I hopefully we'll get a bit of movement on that, so that we will have that advice put out with cows endorsement on it. And yeah, would hopefully there's advice there for vets and farmers on the possible actions around anthelmintic resistance or insensitivity detection. Yeah, the sort of research gaps that were identified are probably the same sort of gaps that we would think of in there. That basic biology of lungworm epidemiology, as both Eric and Leslie and I have talked about it. There's that change. We all know that there's change in climate change and management practices. So this is how, a lot of the basic research was done 50, 60 years ago. So how is it changing? What are those interactions between roundworms in the gastrointestinal tract and lungworms? We know that in the GI tract, there's an interplay between them. So how does that interplay work? How do drugs work now as compared to where they did when they were first licensed? What's the state of play of resistance if it's there? How do we validate cases? Again, as we've just said, that development of diagnostics to help identify those problems. They're still very reliant on fecal larval counts and sort of invasive blood testing or bronchoalveoli lavages and these sort of things. So they're very, very invasive. Are there better ways that we can look at inefficacy without the need for those? Can we develop molecular tools? Yeah, and that needs to integrate the tools that we have. How do we integrate anthelmintic usage and vaccine usage in amongst it where it's required? Yeah, again, as was previously, just to acknowledge those who were very much involved in this, Helen and Heather, who are pictured here. Natalie, I couldn't find a picture of, very camera shy, so I think, and Lindsay, and of course all of the attendees that were there. So thank you very much for your time.